I'm Gordon McVie and I'm the founding editor of eCancer, and my co-editor when we founded this together was Umberto Veronesi, the late Umberto Veronesi. And I have to say, even months on, we still miss him very, very much indeed. When he and I sat down to plan the journal, we only disagreed about one thing, and that was paper versus the internet. You can imagine his absolute delight to hear just a month or so before he died that eCancer, which we had set up on the internet, had actually achieved 14 million visits from doctors and healthcare professionals in 196 countries. A fitting message for him as he deteriorated tragically. But he was very, very, very proud of what we'd achieved in eCancer, and we wanted to show the kind of depth of feeling that there was amongst all his many pupils, all the collaborators, and even some of the family, about his massive contribution to cancer care for women, but also for men. And we pulled together 6 super articles in a special issue, and we'll be launching these at the Milan Breast Conference, one of the many innovations that he set up. Umberto's a polymath. He was a guy who was interested in everything. He was also knowledgeable about everything. He was not just a scientist and a pathologist and a surgeon, but he was an ethicist, he was a musician, he was a broker for peace. And he was most effective. He worked at all levels of society, including the Minister of Health. Can't be too many surgical oncologists who have achieved that level of influence. He was extremely important in the political arena, and he set up a variety of important European and international organizations. He started his leadership role when he was made director of the Istituto Tumori in Milan, and he made a superb job of that. He not only got his surgeons in 5 divisions to collaborate together and to see clinical trials as the first option in reviewing the future management of any single patient, but he actually involved the other people, the other disciplines, the other people in the silos. He was vigorously anti-silo. And thank goodness for that, because without that, Johnny Bonadonna, that remarkably brilliant medical oncologist, also sadly deceased, who was given his support at the Istituto Tumori and developed ABVD, the famous cocktail for Hodgkin's disease, which has triumphed over all the other competitors from North America and from the UK, like MOP and MBPP, but also CMF. What was CMF? CMF is cyclophosphamide methotrexate 5-fluorouracil, and this was the first combination adjuvant chemotherapy, adjuvant after the local treatment of breast cancer. And of course, because of the discipline, not enforced or coerced by Umberto, but quietly led by example, patients in Istituto Tumori were treated with breast cancer along particular lines, many of them in clinical trials. And therefore, Johnny Bonadonna could come in with his trial of CMF as an adjuvant therapy, knowing that the patient base had been uniformly managed and managed to the top level of any surgical oncologist. Umberto Veronesi is known the world over for quadrantectomy. What is quadrantectomy? Well, it's otherwise known as lumpectomy, not appropriately, because it's not a lump. And he tackled this because he was astonished by the apathy of the medical profession, and particularly the cancer profession, who accepted that there was no other way to treat breast cancer than complete mutilation. Total mastectomy, plus muscles sometimes, then radical radiation therapy, leaving the woman in a devastated state, not just physically, but mentally. And he rebelled. He rebelled all his life. And in this instance, he rebelled against the sort of the biblical certainty that meant that research into this area was seen to be useless and pointless, because this was the way it was to be done. So, having been a pathologist in training, he was convinced that for early breast cancers, sufficient surgery would be a quadrantectomy. That's a quarter of the breast, and that's what he called it. And eventually he put together a research protocol comparing the Halsted, which was the biblical version, thou shalt do a Halsted, versus the small limited surgery with limited radiation therapy after the surgery where appropriate. This was not welcomed with open arms by his colleagues. In fact, many people thought he should be driven out of the profession. I remember very well when he was president of the EORTC, just a couple before me, and he was trying to whip up enthusiasm for a sort of wider version of the original trial. And where I was in Holland at the time, and it was welcomed by the Dutch oncologists, not so in the UK. And the only centre that contributed to the EORTC trial of limited resection of the breast versus mastectomy was King's College London, where I'm now a visiting professor. He got his way, and 20 plus years on, the answer is known to everybody. There just is no difference, and except that the woman has got two breasts and not one, and the woman's quality of life is immeasurably better. This sort of sums up Umberto's attitude to medicine. You treat the patient and not the disease. At Istituto Mori, Umberto worked also with the laboratory. He believed that the status quo wasn't acceptable, and that we needed to find out more about the biology of cancer and understand what went wrong in carcinogenesis and how we could prevent that. He was an advocate of prevention and chemoprevention his entire career. He could speak the language of the laboratory scientist, and at INT, represented in one of the articles by Marco Pierotti, who talks about the new dawns of personalized medicine based on genetics. He took his enthusiasm on to the European Institute of Oncology, which he had really didn't build brick by brick himself, but he was the man who put it where it is. And there he established probably the biggest breast cancer centre in Europe, if not further afield. There's a paper here from Corso, and Paolo Veronesi, one of the Veronesi family, and Viviana Galimberti, just plotting out the story of developing the minimum but most effective treatment for breast cancer. And of course, management of the breast is not just about the breast, it's about the axilla and about how to prevent awful lymphedema occurring in women who may be successfully cured of their disease. And there are two papers in the special issue, one from Aguilera in Costa Rica about the roll technology, and the other from the European Institute of Oncology, Paganelli, who really worked out the first sentinel node trial, which was published as long ago as 2002, although some surgeons are still to read the paper and work out how to do it. There's always been an internationalism about Umberto's work. He worked together with American groups, he worked together with the European groups. He was past president of EORTC, and there's a paper from the EORTC group by Ades in the Clutch, which also covers the big group, which was a truly international group of breast cancer researchers. And this too is worthwhile a pause and a read. He quoted Plato once as saying that you have body and soul and you can't separate them, and you certainly shouldn't even try. And again, to come back to his holistic view of medicine and treating the patient and not the disease, you'll find a contribution in the e-cancer special issue from Katie Mazzocco and her colleagues, in the cognitive psychology department of the University of Milano. Ketty and Professor Bravatoni have contributed a great deal to building up the science behind cognitive psychology and how it helps patients with cancer. You can read all about their work, again from UNIME and from IO, in this excellent group of articles. Umberto was a great trainer, he was a great teacher, he was a great communicator. He loved e-cancer because of the way that we can communicate to the world and not just via magazine which sits in the doctor's surgery. And he loved it, especially when e-cancer developed e-cancer patients, because it was the patient and not the disease that he really shouted from the rooftops. We still miss Umberto very, very much indeed, but we do not look backwards in e-cancer, we look forward and we celebrate his astonishing contribution, his entire life in making cancer patients confident and happy, and many, many, many times cured. So I hope you enjoyed the series.